help us better understand hormone imbalance, what it is, and how to treat it.
That's right. He's a Milwaukee-based primary care physician and menopausal practitioner certified by the North American Menopause Society.
That's right. We're reading off our scripts today because we're having some problems with our prompter, so bear with us. During the past 7 years, he has been helping hundreds of women and men in our area with hormonal imbalance. Dr. Stula of Life Steps Wellness Clinic is here today along with one of his patients, Susan Rancic.
Welcome both of you to the Morning Blend this morning.
Thank you.
Thanks for being here. Dr. Stula, how does hormonal imbalance affect our lives? I mean, it has to affect people on a daily basis.
You have to understand there is an endocrine system in our body that controls the balance of the hormones for our good physical and mental health. And if that doesn't occur, we're just in an imbalance. This is like a seesaw being tipped.
And we have a visual here that kind of helps describe what you're talking about, that imbalance. Do you want to talk a little bit about what people see on the screen there?
You see all the glands, they are really in balance, and they are controlling all the functions of our body.
And when it gets out of balance, because that's what we're talking about, how do you help both men and women? I mean, we're not just talking about women here with hormonal imbalance, also men, which I found very interesting.
For the fact, women are the first one that recognize this, and they both have to recognize they have that symptoms of hormonal imbalance, which they come to us, and of course at that point we do a good actually history and screen them. Many of them do not qualify for the hormones. Then do a thorough physical examination, do some lab tests, and after all this, the most important thing is to form a partnership between the doctor and the patient, educate them, that's another important fact, and tell them how to maintain their lifestyle.
And their balance. What are some signs that someone's hormones might be not in balance?
There are multiple symptoms, and you can see them that they are both for men and women. Women are recognizing them much faster than men.
And there are things they can do to help themselves too, right?
There is definitely, first of all, women and men have to do a lot of reading by the fact that they know that they are supposed to come to a physician and then be treated. And the most important thing is if they take the hormones, they should really maintain a good lifestyle. They have to exercise, they have to eat properly, and of course, above all, avoid the stress. That's a big factor, and it's easy to say, avoid it, but we know all that we run into a lot of stresses that...
Stress is everywhere.
Exactly.
Susan, how did you get in touch with Dr. Stula? What were you going through in your life, and what are some of the symptoms that you noticed?
Definitely my symptoms. I was feeling tired. I had no energy. I was depressed and irritable. I also had headaches and insomnia. And then through my reading of articles, books, and web searches, they all pointed towards my symptoms as possibly being related to hormone imbalance. And then, as my t-shirt reads, educating myself was the best thing I've ever done about my health and well-being. And then a friend told me about Dr. Stula.
Now, would you mind if I ask you how old you are?
Not at all. I'm 51.
You're 51. Now, as far as your symptoms go, what do you think Dr. Stula has done to help you then?
Well, I first saw Dr. Stula in February of this year, and he examined me, reviewed my history and my lab results, and then prescribed 3 different bioidentical hormones just for me.
Were they the ones that you put on your arm here?
The cream.
Wow. And they just absorbed into your skin?
Yes.
And you felt some relief from your symptoms?
Oh, absolutely. Absolutely. Since I've been taking them, of course some days are better than others, but overall I feel like a new person, just like I did before entering menopause. Feel wonderful.
And will you continue taking the hormones, and how do you feel about the continuance of what you were prescribed?
I've never been a big fan of synthetic drugs because I'm afraid of the side effects, and actually I haven't had any side effects at all since taking the bioidentical hormones. I will continue to take them for as long as I need to feel better.
Because a lot of people have safety concerns about hormone therapies that they hear about, but you've felt You haven't had side effects, so much so that you're willing to continue taking it and feel that they're safe.
Yes.
That is great. And do you do other things to help maintain your healthy lifestyle?
I've always followed a healthy diet. I don't eat any red meat, fried foods, or fast foods. I eat tons of fruits and vegetables. Drink lots of water. I also take vitamins, especially calcium and fish oil, and I exercise.
Wow. That's the kind
Yeah,
of patient
I
everybody
do.
wants to have, right,
I
Dr. Stula?
Because you say the patients have to take care of themselves also, because you can recommend the hormones for them, but they have to do their own work too, right?
Exactly. It doesn't, hormones won't work alone. That's a whole lifestyle change, and it's a new life for women. And they are really very happy the way they feel after they do all these things.
And it can be safe to take them long term.
You see, there were observational studies with those natural bioidentical hormone, and they didn't show any risks whatsoever. As a matter of fact, they derive from the plants, and they are identical chemically with the hormones that our body is producing.
Wow, that
That's
is
the
great.
beauty of it.
Great news
Yeah.
for women, because so many people want to get their hormones in balance, knowing that how it affects their lives.
Dr. Stula
Thank you
and
so
Susan,
much.
thank you so much for joining us today and talking about your services and about your life. Thanks for
you.
opening up and talking to us about it. If you would like some more information, and if you're facing some of the symptoms that Susan described or Dr. Stula described and would like to have your hormone levels tested, Life Steps can provide you with a test kit and written materials about bioidentical hormone therapy. The contact information is right there on your screen. You can call them at 414-906-1998.
That's great news. Thanks again.